Medicine has become a business, and it really should not be a business. I don't think that I would tell my child in this day and age to become a doctor. It is absurd to me that this is allowed in our country in 2025. I honestly think that it's no wonder that people are leaving medicine altogether. Hi everybody, welcome back to my channel. In today's video, we're going to be talking about hot takes about medicine, about being a physician in 2025, about being a mom, and how I have so far found it, and my personal opinions. Obviously, take all of these with a grain of salt. These are opinions, but I think they're true, and let's see how you feel. If you're in agreement, let me know below. Let's just hop right in. Let's start with the hottest take of them all right now with everything going on in the news, and that is that insurance companies have far too much power in medicine and in patient care, medical care, the whole thing. I really mean that. If you're a patient, you have probably lived through this experience of trying to get something approved, figuring out if something is approved, if something has prior authorization for a surgery or for some medication, if you are waiting for a life-saving treatment. Literally, insurance companies can deny you, and you may not get that life-saving treatment. It is absurd to me that this is allowed in our country in 2025, yet here we are in a situation where patients can't get their prescriptions renewed that they've been stable on for years, that patients are forced to pay out of pocket for thousands and thousands of dollars for medications that are approved for the indication that they are being used for. Like, not even an off-label use, not even something that is, controversial or something that is, I don't even know. Like, it is just crazy to me that insurance companies have so much authority to say, your patient was in the ICU for 5 days, but we're not going to cover that because it's not part of like your insurance plan or something like that. Like, we as physicians don't put patients in the ICU unless they need to be in the ICU. Like, resources are not just superfluous. We have limited resources, and we really try to make sure that the sickest patients get the care that they need and in the appropriate places that they need. And so we are not just putting people in places that they don't need to be. And yet insurance companies feel like they have the authority to say that, no, your patient should not have been there. I think it's just crazy. Same thing goes for like radiology studies. We see patients all the time that don't have the right study approved by insurance. They have the wrong study approved, or the insurance company wants you to get different testing before you can get the imaging study, and it just delays patient care. The patients get sicker, and ultimately it costs the healthcare system more than just doing the right thing the first time. So overall, very confused about how we got to this point in medicine. If I could change one thing about the medical healthcare industry, it would be that insurance companies should not even really exist the way that they exist. I think that honestly, a lot of physicians that I know are patients of other physicians, just direct patient care, because insurance companies really make things very challenging, very difficult to get the right treatment in a timely fashion. So that is my one biggest hot take, I would say. That brings me to hot take number 2, which is sort of hand in hand with hot take number 1, and that is that medicine has become a business, and it really should not be a business. A lot of this has to do with insurance reimbursement for hospital systems. A lot of this just comes down to the numbers, that for whatever reason, hospitals feel that doctors are expensive and that hiring other people to try to do some of their work is supposedly going to offset some of the costs, even though studies have shown that, for example, mid-level providers do end up costing the healthcare system more than just hiring a doctor, for example. But whatever it is, I think that medicine should not be a business, and it really puts the focus on the wrong things. So what are the wrong things that I'm talking about? The wrong things are efficiency. Why should a doctor get more money for seeing more patients when you know that if you're seeing a patient in 5 minutes versus 30 minutes, that patient's going to get less, like, poorer care, essentially, right? I don't have time to sit down and interview you, to figure out really what's going on, to do a thorough physical exam. And you expect me to create a diagnosis out of thin air, when in reality, we should be rewarded not just for the number of patients that I see in my clinic, but also for the quality of care that I'm providing. And really that goes with, like, am I providing a correct diagnosis? Is the patient getting better? Is the patient feeling better? And then on the other hand, they also, like, they being hospitals and insurance companies, want to judge doctors by patient satisfaction scores. On the other hand, hospital systems and insurance companies want to reimburse or sort of reward doctors for patient satisfaction scores. Now, you tell me, how am I supposed to get a 10 out of 10 patient satisfaction score when I only have a 5 or 10 minute patient slot? Or you've double booked me and now I'm running behind. Obviously, patients are going to be upset when I'm late to their appointment because you have double and triple booked my morning and I don't have time to properly sit down and talk to all of my patients. So it just feels like hospital systems and insurance companies are really, like, squeezing the doctors. Doctors end up being villainized because we don't have time and, honestly, bandwidth to see this many patients. And then at the end of the day, our patients they are unhappy because they don't feel heard. They feel like we are constantly in a rush. And it makes me so sad to see doctors just who want to practice good medicine who just can't. And again, that brings me back to direct patient care. So many physicians are changing practices and becoming direct to patient care because then they can set their own terms, they can set their own patient visit lengths, and that might be something you don't know, that doctors don't necessarily have control over their schedule. A lot of times administrators are the ones who say, no, you have to see this many patients every day. If you don't see this many patients, then, you might get fired, or you won't get your full salary, or you might have to do X, Y, or Z. And so physicians are forced into these schedules where patients are inherently unhappy because they don't have the time to spend with every patient. So overall, I would say that medicine as a business is just not a sustainable business, or at least in the way that medicine should be practiced. Physicians go into medicine because they want to help people, and trying to see as many patients as you possibly can in the shortest amount of time possible is just, yeah, medicine should not be to maximize profits. And ultimately, the person that's getting those profits is the hospital system and is also the insurance companies. And it's definitely not the doctor. I think that there's a chart which very nicely delineates the number of administrators in healthcare versus the number of physicians. And you can see exactly where medicine is going, where it has been. And it's just very unfortunate. So that is my hot take number 2, that medicine has become a business, and it has no business being a business. It is not supposed to be about the money. It is not supposed to be about profit. It's supposed to be about patients. And unfortunately, our hospital systems and insurance companies have totally lost sight of that. Okay, the third one is, again, sort of in the same vein, but slightly different. And that is that you as the patient are in charge of your own health. You as the patient have to be your own advocate because, unfortunately, the system seems to be working against you as a patient. And we as physicians also feel like it's working against us. So we sort of have to advocate for each other. But as someone who has been a patient, you really have to advocate for yourself because nobody knows you better than you know you. Your doctor doesn't know you better than you know you. And the insurance company certainly doesn't have your best interests in mind, nor does necessarily your hospital system. So definitely, if you feel that something is off, if you feel that something is not right, you think that you need a longer visit, you need to see somebody else, you have to sort of take charge of that as the patient. And I can give you my own example of after I had a baby, my first baby. I was not supposed to have any more symptoms of childbirth, and I still did. And I advocated for an ultrasound, even though everybody told me that, no, like, this is normal, this is fine, you're supposed to be fine now, like, this might happen for weeks. And I was like, no, I think something is still wrong. And I literally, like, pushed and pushed for an ultrasound. And of course, I'm a radiologist. I'm like, I just want an ultrasound. If it's totally negative, I'll be happy and I'll move on with my life. It was not negative, and I required a procedure, which happened like in the next couple of days. So if you are a patient, you have to take ownership of your healthcare. You can't assume that anybody else is going to do so, because at the end of the day, the only person that can really help you the most is yourself. And it's very sad. I really wish that healthcare was different, but unfortunately, you are your best advocate. And that is my next hot take, is just that you have to look out for yourself, because your doctors are doing their best, but still nobody knows you better than you do. Not even your doctors, not even my OB, as much as I loved her and I loved her so much and I miss her so much. I wish she was here for this pregnancy, but alas, it is what it is. The only person that can advocate and knows you the best is yourself. So make sure you do that. The next one is pretty much totally shifting gears, although since I talked about having a baby, I guess that brings me into my next point very nicely, and that is that it is very difficult to be a good mom or a great mom or a perfect mom. In fact, it's impossible to be a perfect mom, but also be a good doctor, a great doctor, a perfect doctor, at the same time, both in the traditional sense. Like, obviously you can't be a stay-at-home mom and be a full-time doctor at the same time, but also it's hard to be a very fully present mother, a mom who cooks every day for their kids, a mom who is there for every drop-off and pick-up and concert, and also a doctor who is there at every moment for their patients. And I think that I know that there are people that do it all, and hats off to them. For me personally, it required a lot of outsourcing. It required a lot of just working part-time. It required a lot of talking to my husband and figuring out where we're both going to contribute at home and contribute at work financially and contribute as a parent. But those two things are very difficult to do simultaneously. When you see a female physician, just think about them as a mother as well, like having to go home and also do so much of the housework, so much of the mental load of being mom. And yes, there are great dads out there too. This is no hate to dads, but traditionally, and just from my own circles and my own friends and families, I know that moms they hold so much of the burden of the home stuff. And they also are expected to, of course, be great doctors at work. And it's very difficult. Like, I don't know how people do it without help. So that is my hot take number 4, that it's obviously not impossible, because I know people that do everything, but it's very hard. And for me personally, it did require me to sort of step back by taking my child to daycare, because how can I work and also watch my child? Like, it's just, you can't do that. But also working part-time has really helped me a lot. And like I said, outsourcing things that I would rather not spend my energy doing, like cleaning my house, for example. So very difficult to do both. They both require so much concentration. They both require time. I think time is the biggest one, that like being a good doctor requires the time face-to-face with your patients, but also charting at home. And that can be very hard when you have a 2-year-old who is running around and just wrecking your house. So hats off to the people who do it. But yes, very difficult to do both. And being a female physician is no joke. Okay. All right. We're almost there. We're almost there. This one isn't too long. This video isn't too long. Okay. On to hot take number 5. And that is that I don't think that I would tell my child in this day and age to become a doctor. Obviously, if she wants to become a doctor, that is obviously up to them. But I would not say that this is the greatest profession of all time, that this is the most... It is rewarding. Of course, I feel like I have a very rewarding job, but I don't think that it is the end-all be-all of existence, the way that many of us were taught and many of us were told. I think that back in the day, being a doctor used to be a lot more prestigious. I think it used to be a lot more respected. And now there is a lot of distrust. I think a lot of that comes from doctors not having enough time to spend with the patients. It comes from just a lot of anti-science media. It comes from a lot of wrong data that exists out there that circulates. And I think that social media just really has exacerbated a lot of issues that exist within the healthcare system that are not necessarily the fault of the doctor, but end up being put on the doctor, and has truly villainized physicians within society. I mean, no matter where you look, you'll see things like doctors are not paying attention, doctors are overpaid, doctors are just trying to milk you for to give you these pharmaceuticals. They have a share in the pharmaceutical stuff. And it's just really sad and disheartening to see. So I wouldn't want to subject anybody to this type of like, I don't know, verbiage, and I don't want to say like just sort of negativity. It's just sad. It's just really upsetting to see those things when, you work through very difficult times. You see really horrible things. You see stuff that people really should never have to see. And then you have to go about your life just like you never saw anything like that. It's just, yeah, I don't know. I don't think that I would ever want to place that burden on my children. And I honestly think that it's no wonder that people are leaving medicine altogether. Like they're just leaving their degrees behind, they're leaving their experiences behind because it is sort of traumatizing. And on top of that, to be villainized, and on top of that, to be told like you are just milking it for your own prestige and respect and money and all of these things. And you're just like, why would I do that to myself? But it is what it is. That is unfortunately the rhetoric that exists right now. And so overall, I would not subject my children to that. I would say choose something else. But I reiterate that and I've mentioned this in my last videos, that I personally am very happy with the way that sort of my life and my job and my things have turned out. But I know just as many people, if not more people, that are burned out, that are depressed, and that are like just so over medicine because of the way that it has ended up becoming. So those are my hot takes. I hope that this ended up helping you in any way, shape, or form decide whether or not you wanted to go into medicine, or if you made the right decision, or if you are over the whole thing. But yeah, please subscribe to my channel. I plan to make a lot more videos about being a mom and how I make it all work, and even how I found my job. So if that's interesting to you, please subscribe. And yes, I will see you all on my next video. Bye.